We've developed this into 3 large proposals, which Rob Egge can help explain to you, but I want to outline them just for a minute. The first is to shift the whole debate towards a health-based health reform. You know, we reached a conclusion, and Rob will share with you a handout that we use, that health reform actually occurs in 4 different boxes, and that one of the reasons it doesn't get done very well in Washington or the state capitol is that everybody stays in the least important box, the box about finance. In our 4-box model, the first box is the individual. You're a partner in your own health. If you're diabetic, you have to take care of yourself. If you're obese and pre-diabetic, you have to watch your diet and you have to exercise. If you have arthritis, you have to be engaged in your own therapy. I know. My older daughter, Kathy, has had rheumatoid arthritis since 25, and because she actively manages and is a partner with her doctor, she has a dramatically better life. And today, thanks in part to her training program and in part to modern breakthrough miracle medicines, she can walk in a marathon, 26 miles, something that was inconceivable the year she was diagnosed. So our first goal is to have you, the individual, engaged in knowing about your health, being involved in your health care, being a partner in managing your health, focusing on wellness, early detection, and doing the right things, and then focusing as a partner in chronic disease management if you have a chronic disease, or focusing as a partner in rehabilitation if that's what you have to go through. But in every case, you're really important. Our second goal is to have the society and the culture reinforce that. So for example, with teenage diabetes and obesity, where we now have kids who are overweight, under-exercised, and at 12, 13, and 14 getting what used to be called adult onset or type 2 diabetes, which they shouldn't be getting until they're in their 50s or 60s, with horrendous potential out-year problems of 15, 20, 25-year-olds losing their limbs, going blind. After all, diabetes is the leading cause of adult blindness, having to have kidney dialysis, having cardiovascular disease. Remember, the diabetes is the leading cost driver of Medicare. Every 4th dollar in Medicare comes from diabetes. And to imagine that starting at 12, 13, or 14 is a terrifying prospect financially and in the quality of life for young people who end up diabetic prematurely. Yet that requires a program of diet and exercise. So we favor rethinking the school lunch program, rethinking the school breakfast program, rethinking what's available to be bought in school from machines, and we favor K through 12 5-day-a-week physical education. Finally, we even go to meddling and suggest that school systems transfer some of their money out of the school bus program to paving pavements so that kids can walk to school if they live within a mile of their school. I know these are bold, radical ideas, but we think a healthy society and a healthy culture reinforcing the individual gives us a lot more strength for the future. Third, we look at the actual delivery system, what you're engaged in as physicians, what hospitals do, dental offices, pharmacies, and we think the delivery system has huge opportunities for improvement. And it's in that framework that we are proposing a health-based health reform model. It's a very straightforward concept, that we're going to reach out to find best practices everywhere in the country, and since we know that the Institute of Medicine says it takes up to 17 years for the average physician to get a new best practice, we want to design a model where the government incentivizes and encourages and helps train so that new best practices go everywhere. Let me give you a single example. Imagine that we could take the 10 best hospitals in America at avoiding giving people hospital-induced infections. And imagine that we had the 10 worst hospitals in America at giving people hospital-induced infections. Consider the difference in convenience, illness, length of time in the hospital, cost. Yet almost every single thing done in the 10 best hospitals is fairly inexpensive, and it's a matter of culture and management and setting up the right thing. Something as simple as using an antibacterial soap between each hospital room. Now, the difference is stunning, and if there's no program today in Washington or anywhere else to encourage every hospital to migrate to a best practice for avoiding hospital-induced infections. That's just one example of what we mean by a health-based health system.